What have you found when you've seen an individual that when you've decided this person legitimately is a danger, this person needs to be, confined for the rest of your life? Is it always a combination? Is it sometimes one to the extreme? Or what do you find the most, I guess, give us the most consistent profile you have for that kind of an individual that you've seen,
So we usually get in trouble on profiles, but what I can tell you about is factors that are most associated with, and let's say violence risk, because there's a lot of different kinds of risk of child abuse, risk of sexual reoffending, risk of domestic violence. Here we're talking about, risk of violence towards other people, like in murderers. So when you're starting to talk about risk factors, there's some things that are almost always associated with it. We had a maxim in psychology for a long time that said the best predictor of future behavior is past behavior. Well, that's only relevant in the case of people who murder or do serious harm to other people if that's a pattern in their life, not if it just happened once. We can all get so mad that we jump out of the car or during the middle of a traffic stop and get angry with somebody who's been driving slow and brake checking us and do something stupid like hit them and they fall down and hit their head and get hurt or die. So we can all do a stupid act and have terrible consequences as a result. It's the pattern of violence that we look at. So those people that had more violent episodes in their life starting early on, like in school, like in grade school, where they suspended for fights and physical altercations, problems like that, maybe fighting with teachers or stealing property from other kids and then fighting with them and not giving it back. Early onset violence, frequent violence, all those things contribute to assessing a person as a higher probability of a risk. There's some other factors too, and some which I didn't mention before. The use of drugs and alcohol. That's one of the most common findings in acts of aggression. People who abuse, especially drugs like cocaine or flakka or alcohol. Those substances are oftentimes associated with increased risks of violence in the future. And I'll mention one other one for you, although there's many of them. The other is any kind of neurological damage or brain damage. We do know that there's a higher rate of violence or aggression for people who have suffered head injuries, especially multiple head injuries. They have difficulty controlling their impulses. Not all of them, but many of them have difficulty putting the brakes on their behavior, which ordinarily most people would put the brakes on their behavior. So those factors all start to coalesce. And as you can think about this recipe for danger, the more of the risk factors that you have, your age and your gender, whether you've been violent before, if you've had a head injury or a mental health problem that has things to do like paranoia, mania, if all of those things can kind of work together to increase or decrease your risk.